I don't know if you know, but for the last few years, 2 labs die every single day in the USA.
2 labs die every single day.
Yeah, so
Really? I was talking to someone the other day and they're talking about what it's like to be a lab in America.
because he did 4 arches in one day, which is in American dollars, that's $100,000 worth of production.
That's
And
insane.
The truth is, it's like everything else. You can market your lab really well, and you can kind of kill yourself because you grow too fast.
This is one of my favorite people in the dentistry industry is Mike. Mike, obviously, you're an implantologist. You're a very, very known dentist in the industry. I can't imagine how many podcasts you get invited onto. Does it happen often?
Yeah, I actually get invited to a lot of podcasts. So you're pretty lucky that I accepted this podcast because I see your brand. I'm a customer of GreatLab, but honestly, I get invites every single day for podcasts. But honestly, we just don't have enough time in the day to make them on all the podcasts.
I got you. Obviously, look, you've got an in-house lab, right? And you've got multiple clinics, and you've got the implant institute. So you've got so many things going on. But you're considered pretty much, I think, the king of scanning, right?
Sort of. I teach a little different method of scanning that a lot of people don't kind of use. So how do you get the king of scanning?
I gave that to you. I titled you it. I titled you.
Awesome. I'll gladly take it.
Tell me, like, so when we talk all the time, I always wonder why, like, there's this like, I've seen some scans coming in from dentists and they can be like dreadful. Like, what is going on with, like, is it the technique? Is it the fact they're sold a scanner and they're never shown how to use it? Like,
let me just give you a story on that, right? So I kind of take responsibility myself. I teach a lot of dentist digital workflows, and sometimes I go and help doctors do surgeries at their office, and I really focus on digital scanning for a long time, an hour in a 2-day course, hour and a half, and we really focus on it because everything in is garbage out. But what I've seen is that, honestly, the doctor doesn't even know the scanning portion, so it's like sometimes the blind leading the blind. I hate to say that for my fellow dentists, but really, this is what my friend told me, honest truth. He says, man, look, Mike, it's all digital, but you got to know, you started your career digital, which I did. He says, we went all analog, and in dental school, we didn't know anything analog. So we've been set in our ways for 20 to 30 years, and now this is like a esoteric knowledge, it's very, very hard for us. And I'm like, man, I may suck as an educator or that perspective, a combination of the two. I'm not so great and I need to improve. And the dentist always kind of like a deer in the headlights. So one of my students, I went to his office and the assistant was scanning terrible technique. And my assistant looks at me in the eyes and says, hey, why don't you go teach them how to scan? And I'm like, well, shit, he took my course. He should have been. But I think that's one of the major problems is the dentist has to lead the way and really train their assistants how to properly scan.
I got you. Well, what is the biggest one? Is it like the holding of it? Because we've talked about it before, and I've seen people doing some crazy stuff like scanning like this. Like it's about the technique of actually holding it, isn't it?
I was actually traveling with this thing. It was down the hall, but this box was a little hard to open. So I got a Trio 5 without a tip on it. But this is kind of what I've seen with scanners. They hold it like this, and they're looking at the screen. So I always say, if you're holding it like this and you're looking at the screen, your scanner is moving like this, and you have these big muscles, right? You're not using the fine muscles, but every dentist is going to hold their handpiece like this with the small muscles, and now we can move it really, really fine. And what I teach is I don't look at the screen, because when you look at the screen, this is what I see happen. Their scanner tip moves up and down like this. They're looking away, and they do like this. So quite frankly, these scanners are made so you can use the auditory sounds, and it goes all this shaking. So that's why I can just scan the auditory fully, really, really fast. In digital dentistry, less is more, meaning if you have less images and it's a smaller file, it's going to be potentially more accurate. So I use that sound to guide me. So if I'm scanning and it's like this, so it's telling you, hey, it's having a problem stitching. So if it's guessing, why would I wait to send that to the lab and it comes back and the restoration might fit, versus I scan and it goes, it's telling me, hey, I'm stitching everything together correctly. And I always tell our student doctors that, hey, if it doesn't stitch correctly and it only took you like 10 seconds for the first pass, why would I keep on doing that? Or itero is notorious because it doesn't have any auditory noises, but if it starts freezing on the screen, well, it doesn't know what the hell it's doing, so it doesn't know what the hell it's doing. So if you're a dentist that doesn't know what the hell you're doing, you're going to send out that scan. And I see it day in and day out. Just being brutally honest here, I imagine you see a lot of things in the lab yourself.
Yeah, definitely. Definitely, definitely. I think lots of labs are afraid to say it to dentists, right? They're afraid to say like
Right to
your
lose the.
scans. Yeah, afraid to lose the business. How would you go about it? So your lab, how would you
So
like it? Imagine you're a
I'll
very
talk to
bad
you.
scanner.
I'll speak as a dentist first because I built my lab right from when I graduated residency and I didn't know shit about the lab industry, but I worked myself backwards. Hey, I saw a successful dentist. They had an in-house lab and a ceramist. Of course, I was doing everything myself at first, but I had to spend some time in the labs. And then the labs showed me all the impressions. They said, look, we know who's a good dentist or a bad dentist. So if you ever want a referral, you go to the lab. That's what I learned. They'll tell you who the good dentist or the bad dentist is. So going to the lab and having that perspective, when I started working with labs, I told them, hey, if my impression is bad, you make sure to send it back and tell me if I need to redo something because I'd rather do that than produce bad quality work. So I think as a dentist, speaking as a dentist, it starts with the dentist first, setting that precedent early on because I knew labs would be scared to lose you as a customer. So I said, man, screw losing me as a customer. Tell me I want to do the best work possible. So I stepped that in as a dentist and a small lab owner. I think it goes back to the dentist really is the communication because that's my perspective. I've also got dentists that says, screw it, I don't want to bring the patient back. We'll see if it works. And then you go to the conversation, well, if you got to do a redo, then it's going to be a charge. They say, yeah, we'll make it work. You see two sides of the spectrum.
Yeah, okay. So let's say you're not a dentist and you've got kind of I would say maybe not as an authoritative approach maybe to the space because maybe you're a younger starting lab and you don't want to lose your first bit of clients. How would you like it communicated to you? Because look, you strike me as a guy who wants to always be like better, like aggressively. So how do we not affect the ego here?
I would show that good communication starts with good communication. I would say if you had a portal and send the scans back and mark the margins and say, doctor, are these the right margins? How would you like to proceed and leave it open to that? So some good dentist would say, man, that's really my prep. Man, I really need to take a new impression. But if it's 50-50, the dentist really has to take ownership with it and say, you know what? I'm going to try it. If it doesn't work, I don't want to waste the patient's time. If it doesn't work, I'll send it back and I'll be responsible for that fee. So that's how I would approach it.
I got you. And look, you in your lab, some like I don't know if the dentists who you're working with right now will watch this, but hopefully they will. So what would you say you have to like? You're just communicating with them, saying, "Please send me better scans," right? Like that's it.
Yes. So I've got a wide variation, right? Sometimes man, this is tough. This is tough because sometimes some of the lab people are my friends, and then I look at the scans, and it honestly makes me feel a little bit better because I talk to my designers. I'm like, damn, so I'm not that bad then if this is coming in. And we honestly got a wide variation. Some dentists, the preps look like shit consistently, but they're like, hey, if I need a reprep, send it back to me and I'll redo it. And some of them it looks like crap, and they're like, hey, do what you can to make it work. And I think those clients are the ones that really we're all going to struggle with, right? The prep is bad, the impression is bad, and the doctor tells us do the best you can with it. Yes.
It is. Tell me, like, so with your lab, you are predominantly focused on implants, right? Or you're only strictly doing that more or less?
So it's kind of a mix. I really started off as an implant lab, and now patients wanted to do all that. So we do some crowns, but I mean, if we really want to be honest, a lot of my friends and clients, they outsource to a Chinese lab and they're getting it for like 50, $60. And I just tell them, hey, just send it to that lab. But then they start getting a little bit worse quality and they'll rather spend a lot more for ours. So we don't kind of compete with them. I just tell them, hey, if you want to use a cheaper lab, go for it. We're just not in that kind of space. I think our prices are still pretty reasonable, but that's kind of what we're seeing. They get burned a little bit on the outside labs, or if something happens, the shipments gets delayed and they piss off some patients. And that's kind of the hard thing, right? When you're outsourcing it and things get shipped and delayed and you have to redo it again and it's taking 3 to 4 weeks. Man, but quite frankly, this is why outsourcing labs are so fast. Sometimes you send to China and you can get a case back in a week, man. They tell you 2 weeks. It's insane. Like 3 days.
Yeah.
And the crazy thing is we're in the US, they're a day ahead of us. So by the time UPS sends it, you can get cases in like literally 3 to 4 days. And really that low prices, fast shipping from UPS is really a lot of the death of the lab. So I don't know if you know, but for the last few years, 2 labs die every single day in the USA.
2 labs die every single day.
Yeah. So
really? Well, why? What is it at right now? Would you estimate?
Number one, lack of digital implementation, doing it the old school way. So the costs are still very, very high. and really not embracing digital technology because everybody's doing digital technology. 3 years ago, man, when I started teaching digital dentistry, our digital scanner penetration rate was from 8 to 12%. Now in the USA, it's at 65 to 70%. So that just tells you in 3 years, that's an crazy amount of market penetration. That's the numbers we.
What would you guess the amount of labs there are right now in the USA?
I heard 6,500 last time. I could be way off, but something like that. But a lot of labs have died. There's over a
Okay,
12.
2 labs every day. And
Yeah.
okay, so let's say that keeps going. What's going to happen?
What's going to happen? Sorry to interrupt you though, is but a lot of labs are also losing out because doctor owner labs are coming and infiltrating the market, especially full arch doctors that instead of paying 6,000 on arch for full arch, they buy the mill and kind of do it themselves and have. I mean, we've talked about it. This is where GreatLab kind of knew these things, right? And they kind of.
I ordered his book, by the way.
What's that?
Thank you for the I ordered his book. Thank you for the recommendation, and I listened to podcasts of him.
So he said it. He said even though selling mills and this technology is going to cannibalize our normal business, but you have to live with the times. And he gives examples of Netflix and Blockbuster and things of that nature. And business is all about adaptability and change.
What's his name yet? The founder of GreatLab. Well,
Jim
his first
Glidewell.
name. What's his first name?
Jim Glidewell.
Jim. Yeah, and he has the Constant Change book, right?
Correct.
What was your biggest taking from that? Was obviously you need to disrupt yourself effectively. Yes.
I really liked that he learned that if you want to be a lab tech, he's kind of got those same core values, that hard working core value that he says you always got to put out your best work. And I think a lot of us dentists are kind of the same way. And there's a lot of dentists and lab techs that, they're kind of middle of the road, right? There's just always so much to improve your skills and techniques. And that's what my buddy told me early on. I was a business major and I was starting to open up practices, and we opened up 4 offices in 3 years. Then he looked at me, he's like, man, what are you doing? This profession is very hard. You need to hone your craft first. And I was like, man, you're damn right. I'm not that great. So we kind of scaled back, and for the past decade, I've just honed my clinical skills. So now I've got to a space where I can go back to focusing on business, and that's what my focus is now.
Mike, you send me like an AI dental software like every single day. Yeah, I've never seen anyone wanting to like find the next one. Man, I feel like you give me FOMO when you send me those links. Like, actually do. Jim, in his, I listened to his book, more or less audiobook. He has a big one about the fact that, the labs, it's unfair for him to stay on the bench because he can't grow his lab. I don't know if you remember this bit. He talks quite a lot about that, right? And it's like,
yes.
Yeah, like labs effectively, it actually becomes somewhat unfair because they can't grow. And if they don't grow, right, you can't handle like inflation and increased salaries and things like that. But he is like seriously got it with his strategy. Like, GreatLab must have a huge amount of the market, right? I
think they're like 20 to 25% of the USA market. They're the largest lab in the world, or 18%, some crazy number. I think that was in his book and some of their advertisements. But I think the craziest thing is he's got full vertical integration. When I read he owns the cabinet company, the marketing, and all those things, I just thought the construction company that he owns himself is crazy. Just thinking about
really.
He was saying that if he waits around for a developer, they might take a year, but then he will go in 6 months or 3 to 6 months if he owns the company. And just opportunity cost alone to not service more and more clients is crazy.
I got you. Is he just all about labs, or have they expanded into practices and other dentals?
No, they're mainly focused on like dentists, really.
Right.
On dentists and lowering the cost. A lot of dentists, a lot of labs. I saw that post on social media. They said, what if GreatLab didn't lower the cost from crowns $450 and maybe he just did it to $250, $300, but he dropped the price to $99, and that just changed the whole game.
Yeah. Actually, yeah, he talks about that $99 crown, right? Yeah. Do you know what's I was talking to someone the other day, and they were talking about like what it's like to be a lab in America, and it was very funny. It was like they referred to DSOs as like unions, like demanding like lower prices, so the lab then like becomes dependent on them, and then they demand lower prices. Do you think that like the dentistry market is just going to be consistent DSOs growing?
Man, that's happening every single day. Like more and more private practices are going down in size, right? And there's a lot of controversy about that, but it is really true. So some DSOs just want to switch you to their lab. First, I gotta say there's a lot of differences in DSOs because some have different philosophies. Like one philosophy will be like, hey, you're going to use our Chinese or Vietnamese lab, and they all go to them. And some dentists are like, oh man, we don't want to do that. And some DSOs are like, hey, you know what? We're going to keep on using who you use. It's kind of a better strategy. And then, but you know what? We're going to use our power to get your costs down, and you keep on using who you use. And I think for a lot of dentists, that's a more popular model. But first we got to differentiate. There's two different models, but definitely all the DSOs, for sure. Like my lab, if they wanted to acquire me, which I've got a lot of offers, but I just don't see an end game for me right now.
Everyone wants you, man. Everyone wants you. We get it, okay?
No, it's like they that's their job, right? It's like a headhunter.
Yeah.
They always trying to acquire somebody. So it's like, that's their goal. They reach out to everybody. Let's make that clear. So, but I'm like, I'm having fun doing dentistry. Why do I need to sell out? And number two, like my internal lab, they would nix that right away. It like makes no financial sense, honestly, because when you can send to China and get a $40 crown versus you have manpower here and do those things, but it's a difference, right? We can control the quality. We can give next day zirconia teeth if we want. You can't do that if you have an outside lab.
Yeah, I see. I guess the controlling of the time frame is also really, really.
So what's really popular here is next day final teeth, where you do zirconia the next day. And I think that the offices that have grown a lot have gotten that. So if you're not an in-house lab, how are you going to win on that marketing platform, right? And quite frankly, I fought with this a lot. Like, because it's kind of like false advertising, because they say next day final teeth, and then an asterisk could say we may need to change that later. Final teeth is talking about the material, but the benefit is you don't have a 3D printed or an acrylic temporary teeth that can break, so you can extend it out to 6 months, and then 6 months take your final record. So the offices that have been doing that, I think I always say in business the market always dictates, right? And I think those offices scaled the most. So I'm headed down that track now just to see doing some A and B testings. But
I got you.
But we can do it because we have the mills and we've got the protocols, and we've, if you start a lab, you can't just start off with that. You're gonna make a lot of mistakes.
I got you. How, like, yeah. So tell us just about the machinery you got. So you got your milling, you got like 3D printers. Like, actually, what 3D printers are you using?
We had a lot. We started off with Sega printers. Love those printers. Very, very accurate. I guess being brutally honest, the downside is they're a little bit on the slower side because they focus so much on accuracy. So probably one of the best die models. And then we had Envision Tech, which turned into Desktop Health, which is pretty much a dead company now. So even when choosing your partners, you got to be careful who you recommend technology to. And now we've got like Flash Forge, Sprint Ray. Sprint Ray is probably our biggest one that we recommend to doctors the most, because I don't know if you know, they've got like 95% penetration to dentists in the USA, which is insane.
Yeah, I've seen it. Like, they're charging a fortune for a 3D printer, right?
10 grand. But they've got
that's insane. I have a 3D printer sitting in front of me. It costs $500, and it's like similar size. Yeah, but go on.
So I guess it's all about the workflows, right? They're the only company that focuses only on dentistry.
Yeah.
So then one of the things that when we first started, we would mix our alcohol bath. You 3D print something and you wash the model in there, and then also your crowns in there. But you don't want to mix biocompatible resins that go in the mouth. But what Sprint Ray did was all of our resins are FDA cleared to go in the mouth. So then you can mix those up and it's not going to be toxic to your crowns. But at the end of the day, though, if somebody's putting something in mouth, I recommend having a separate alcohol wash that's always clear. But yeah.
Okay.
But you don't have to tinker with it, right? How much is tinkering worth? But I will say that a lot of companies are making FDA cleared protocols, right? So you can use different resins on validated workflows.
I got you. Oxycontin was FDA cleared, wasn't it?
Yeah. You guys didn't have that?
No. Well, we were in Ireland. Like, well, I don't know. Maybe I can't speak for all of Ireland, but no, definitely not the same. Like, we've seen Dope Sick. We've seen those movies. Yeah.
Crazy, right?
Yeah. It's still a problem a little bit, is it?
I mean, everything's a problem, right? You saw Luigi, right? Did you guys hear about that? Luigi Mangione? The guy who shot the United Health CEO?
Oh, he got assassinated, is it?
Yeah.
Yeah, that's insane.
So that's the biggest problem. If I'm switching back to a dentist perspective, dentists hate taking insurance because like the benefits have been like $1,500 since the 70s, and they've got a valid justification saying, hey, like only like 15% of the people use the full maximum. So why would we need to increase the fees? On the flip side is what we've learned is dental insurance companies, just all they do is, like United Health, they have AI system just to deny your claims. And that's what we deal with all the time. Their goal is to deny the claims and make it harder for insurance to pay you. Whereas the dentists are kind of struggling with higher cost of everything. And then really the CEOs are making all the money, $25 to $30 million a year salary.
Yeah. Tell me, like, so look, I'm Irish. Probably people that watch this are from the UK. Could you explain to us how like the insurance system works in the USA for you as a dentist? Like, because I'm still wouldn't be 100% on it.
Okay, so
Yeah.
pros and cons to everything, right? So I think the dentists aren't don't have a lot. Dentistry in the USA is still kind of seen as a luxury. It's not as a necessity. Whereas I always say dental insurance in the USA is kind of like a dental benefits plan. What does that mean? You've got a maximum like 1,000 to 1,500 is the average, and 2,000 is like the max we see. So if you get in a car crash and you mess up all your teeth, you're not going to be covered. It's not really technically insurance, right? Because insurance should cover the whole loss of your teeth, but you've got a dental benefit of like 1,500. So that's the first thing about dentistry versus medical. Medical, you got to fix your arm. That surgery is probably going to cost $30,000. Medical insurance, you'll pay your deductible, and it'll cover that. You get an act.
How much does that cost? I don't know. So explain to me,
You
like,
go
yeah,
to the
how much?
hospital and you need surgery. Their hospital charge is going to be $30,000 by itself, plus whatever. But the crazy thing is they've had to change their laws here, where if you don't pay your medical bill, it doesn't affect your credit because that affects just medicine alone is just unaffordable here.
Jesus Christ.
So they've got
Yeah.
to change the laws. But what's happened really in the USA is, hope I don't bore your lab customers, but
No, you're
the
not.
insurance companies have won with the consumers here. What I mean by that, they've brainwashed everybody to think that if you don't have dental insurance, you can't come to the dentist. But in actuality, if I'm being honest here, just say our average X-ray exam and cleaning is $200 for somebody out of pocket with no dental insurance. Multiply that by two, and you got 400. So in reality, and I wish I could be blunt to this like my patients, because sometimes they're like, oh, I'm paying for your boat. I don't even have a boat, number one. But
Too busy buying AI things that don't
one time
work.
I was doing a lecture in Arizona, and the guy, I was telling him I was coming to talk about 3D printing, and I was in and out. And he said, oh, you guys dentists charge so much. And I just told him the analogy. I was like, well, what if you didn't change your oil on your car and you went 50,000 miles? That engine's going to be about $10,000, right? I said, dentistry is the same thing. It's not the cost of the dental implants or the full arch restoration. It's really the neglect that costs a lot, because the maintenance is really only a few $100s a year. So having said that, how dental insurance works is most people who are self-employed usually don't buy dental insurance. What happens is you have this big company and their HR department picks the plan for them. And that's what's really confusing about dental insurance. You might have Delta Dental, but you might have different plans and different benefits because the HR department picks your plans. A great company's going to, hey, 100% coverage. You don't need to pay anything when you go to a dentist. Like a crappier plan, which we see a lot, will be, we'll pay 50% of your crown. And so people come in confused, like, why do I still need to pay $1,000 for this crown if I had dental insurance? Well, the reason why is your dental insurance only paid for a metal crown, and they don't pay for an aesthetic ceramic crown. So there's all this bullshit that patients don't understand and dentists don't really understand. Hope that clarifies it, but it's also confusing at the same time.
Yeah, it is. It is extreme. We don't. Yeah, we don't have anything like that in Europe.
Okay, let me give you another example. That might be, so your HR company's got to pay for it. So a patient might be contributing $50 a month every month to their dental insurance plan, right? Or however it is, how they pick it out. So you're always contributing to that. That's why I say that most self-employed people don't have insurance, because they don't pay for it. They're always contributing something, like usually the company pays for a majority of it, or however it's structured. Whereas the federal government, they really, in the USA, if you're a federal agent, like a federal marshal, their plans have $30,000 and the patient has zero out of pocket. So you see the difference in the plans? But that's the federal government. That's why government jobs have better benefits in general.
I got you. Yeah, on the subject of the government, you have a new president.
Yeah, yeah.
How is Trump going to make dentistry great again? Well, it's still great. I think it's great right now. No,
I think dentistry is always going to be good, but I don't know if you know, but like a lot of dentists come out with like $400,000 to $500,000 worth of debt, and the price of the interest rates have gone up a lot. So they're like 8% for the dentist. So every month you're just seeing your student loans go. I'm gonna be brutally honest with you. I don't even pay attention to mine. I've seen mine. My shit is just growing every year, and I just don't pay attention to it. If you pay attention to it, this is what somebody just told me yesterday. She says, I couldn't be a dentist. I became a hygienist because they would give me anxiety. I was like, man, I can see that. So I just pay attention to it.
But is that the American way? Don't pay attention to those interest rates and loans, no?
I mean, the idea is that you're sold that you can have higher earning potential. And I fully believe that. I think that if you do procedures and you get training, you can make a lot more money. And that's, I guess, our plug for 3D implants too. That's what we do. We train doctors how to place implants, and your income level goes a lot higher. And then you should ideally pay for that, right? It's a business, right? But some doctors kind of get complacent and really do don't focus on their business. I was guilty of that. You kind of help me get more focus on that, which I should have done, but I kind of got sidetracked doing our 3D implant institute. But if you don't focus on the business, or you don't even know what to do in your business, and you're making like an average salary and you have a debt service, I mean, it's no secret that that's why dentists have the most suicide rate. It's not hyperbole or anything. It's the honest damn truth.
And yeah, so how much? So it costs like 300-400K or so 200 grand or something to get your degree.
250 is on the low end now. If you're going to
Low end.
NYU or something like that, you're going to come out with like 600 grand. And then if you become a specialist, it's not even unreal for a specialist to come. Now they're going to pay for 3 more years or 4 more years of tuition. I was reading some articles. It's not unreal for somebody to graduate a $1 million in debt becoming a specialist at an Ivy League school.
Damn, should have had a like venture capital investment. Like I mean,
So I guess we should talk about that. That's what's becoming two sides to look at this, right? So that's why dental schools have become a money-making institution now. So some dental schools
yeah,
are they accept more people that they can handle in the didactic area and hope they fail by the time they get to clinic, because they know they can't even service those many students by the time they get to third and fourth year. So somebody's failing out. We had 10 in our dental school. We had 10 people fail out by the time we got to third year. So that's 10 people, $80,000 a year. They're in debt about 160,000. Some people repeated a year, so 80,000 times three, and then they got booted out. So $240,000, and then you don't even have a potential higher earning potential. And then you go into the world with that much debt. So it's wild.
yeah. Yeah. It's shocking. Yeah, actually, to be honest, I'm
Well, let me ask
absolutely.
you, what's the cost of dental school? Do you know in your area?
You're gonna be like I'm gonna tell you like so in university. But see, you see, it's a little bit different because you can expedite your learnings. So how dentistry works in Ireland. By the way, I'm just gonna speak for Dublin Institute, and maybe I'll get this wrong, but I'll try my best. Let's say the university I went to, which was Trinity. Now I didn't study dentistry; I studied computer science. Regardless of that, is that you pretty much pay a registration fee each year of like €2,000. That's the registration fee. University is more or less free. I think for the fine, if you're doing medical though, I think for the one or two of those extra years, you might be paying more potentially for the hospital involvement. I'm not sure, but you really can. Yeah, you'll have zero. Like no, very good. Yeah,
And you guys go straight from high school, right?
correct. Yeah, we call it secondary school. Yeah, but look, there is things like a really, I'll give him a quick plug. Guy I know, Mohammed. He's like he's talked a lot about the fact that when it comes to the actual learning dentistry and like learning like how to actually do implants or anything like that, you would have to go into like a huge program, be in the hospital for about 2 or 3 years, and instead, and I think you might have been on these similar kind of experiences where you might go to somewhere like, I want to say Dubai or Latin America, where there's people who actually are in poverty zones and they actually need to have treatments anyway, right? So you can actually expedite your learning by paying these. I think you've been on these before, right? Where you pay like 20 grand and you can expedite that learning. Is that true?
Oh yeah. So I kind of did what I don't know if we want to go too off topic, but that's what I did. 3 weeks out of residency, I did like 5 implants in residency. When residency, I went to what's called an AGD, Advanced Education in General Dentistry at UT Houston here, and I did about 5 implants, but that's not enough to get in trouble, right? And so 3 weeks after I got a residency, before that, I registered for an all four course because my buddy told me he just did 4 arches in one day, and I was just like, "You made that much money?" And I guess that's really why I made my lab, because he did 4 arches in one day, which is in American dollars, that's $100,000 worth of production,
That's
and
insane.
it's
That's
insane.
insane.
And I was
Yeah.
doing the math, and he's like, he was paying $6,000 of lab fee for each, so 24,000 off the top was gone, and then he's 76,000 versus expenses, so he's still making a good amount of money. And this is where always to be successful, it's who your influences are, right? If you just only work with dentists that aren't successful, you have a different perspective. So he opened my eyes. I was like, shit, it was unreal to me. I was a resident making $35,000 a year and had to pay 6,000 tuition, so we were getting back 29,000 and having to live in the city. I was riding my bike to work every single day, so I wouldn't have to pay $10 parking. That was a good story.
Nice.
So times have definitely changed. But so then I told my brother, I need to borrow $16,000 to take this implant course, and he was like, "Why do you need to borrow that money?" So I told him, I was like, "If I do fillings, my production per hour is probably $600 an hour, but if I do implants, I can make $1,500 per hour. Extrapolate that over my career, $16,000 is a drop in the bucket." And he was like, "Those are good numbers. Here you go. Here's the money." And then ever since then, I never looked back. Right, I started right when I got out of residency.
Do you think not enough dentists like invest in themselves like that? Like just as that?
For sure, because they come out and they're already worried about their debt. How am I going to pay for this? How am I going to pay for that? I look at it a different way. I'm not going to be able to pay for that if I don't invest in myself, because you might make investments here and there, but we always say that, when you invest in yourself, that's the best return you'll ever get.
100%. And if we were to steer that back to labs, like what do you think labs don't invest enough?
The technology and the training, right? So number one, it's the biggest thing is all these lab schools have died down, and I'm just speaking for the US. All the lab schools have died down. So what's happened now is that you're putting like a graphic designer to design teeth, and they're a computer whiz, but they don't understand all these things. Like my lab techs, they went to school back in 1993 and went for 2 years to study occlusion and all these different things. So kind of the same thing that I teach dentists. If you don't know the analog part, how are you going to learn the digital? So the labs are having the same problem. Honestly, the quality is maybe going down on a poor lab, and they're going to lose all their customers because they don't have that base in education. So how can you make a program if there's not a lab school to train your people? Because it's also the quality control and how to scale. The truth is, it's like everything else. You can market your lab really well, and you can kind of kill yourself because you grow too fast.
I got you. Anything you've seen that jumped out at you, like in terms of trainings that were great?
So this is where my bias comes in. Honestly, the best, like just speak on online X labs, the best clinics have a clinical director that looks at all the cases, because if you're going to rely on like just the designer, there's so many nuances in full arch dentistry that you're going to, like, for example, concavities. We know that's a no-no, and you look at the intaglio, you do the water test, right? You've heard that if you put water on there and it stays into that concavity, the bacteria is going to be there. How is the patient going to clean? But you see it time and time again on social media. People show off their cases, and then you look at the design and like, dude, that is shit. You really don't know what the hell you're doing. And we see that time and time again of labs, and there's such a difference between a good lab and you're going to pay a premium for, and versus a lab that probably doesn't have a clinical director looking at all of those things.
Okay, so let's say you want to be an all-on X lab. You want to get into this. Like, would you recommend like finding that implant clinic to work with, or like what would you do if you're in their shoes?
I would probably, if labs kind of like to learning from labs. I've had a lot of labs come to my digital course to learn like kind of the digital workflows. A lot of oral surgeons have come to that learning. They know the surgery course. They wanted to learn the digital workflows. Either take somebody with the digital workflow course, or a lot of labs are actually teaching that now. There's really, it's kind of like me, right? When I was studying and I tried to go around the world and learn from the best implant surgeons. I did Istvan Urbans. Some think he's one of the best surgeons in the world. A lot of surgeons gone to different countries and trying to learn from the best surgeons to try to accelerate my career. Why make mistakes? And kind of thing with the labs, right? If you have good labs, find the best mentors there. They'll teach you, pay them a fee, and then do the best work you can. Or if you're going to learn it on your own, kind of like everything else, right? Business, if you don't hire a coach or a consultant, you're going to get delayed and slower growth. I've always hired a lot of consultants, and people can help me along the way.
I got you. Is there anyone who you've actually like hired for I appreciate you're traveling around the world, but anyone notable?
Actually, I give a shout out to 3D Biocad. That's where I spent a lot of my time in the lab in Seattle. I kind of just went there, and honestly, they showed me a lot of things, how to milling strategies, quality of work they do. So that's what I did. I found a good lab, and that was my distributor for my lab equipment at first. So it's kind of had a mentor lab to do that.
So you pretty much said, I'll buy all the stuff through you guys if you teach me how to use it.
I think they were a good vendor, right? A good partner you're gonna buy things from them, and they're gonna support you to be successful. And that's what kind of
itero sales reps. Yeah.
Why are we throwing Jay this shit?
What? I'm not. I've seen them scan. I've seen them demonstrating that scanner. I'm like, I can scan 10 times better than you. Like I could scan. Like I've seen. Yeah, you've seen the. Yeah, this is surely they come and pitch you all the time. Yeah.
Yeah, I've got a itero scanner, but I've seen that with many different reps pitching their scanners, and sometimes a new rep will know that I teach scanning and we'll get scanner, and sometimes they'll say, oh, you don't need to know, but maybe we can teach your staff. And then sometimes these companies get so much turnover, right? Like a line gets so much, then they come in and say, "Hey, we can teach you on this," and my front team members are just like laughing. It's like, okay, we do this every single day, and how long you been working with this company? 2 months. But
I got you.
but I always say you can't knock somebody's hustle. They're doing their
Yeah,
door to door thing. They're hustling.
100%. 100%. No, I don't doubt that. But the scanning technique is always amusing.
Yeah, that's the
Tell me,
most important part of digital dentistry. If you don't get the scanning process right, everything else is going to be shit.
I got you. Tell me, like, as in, so let's say, like, maybe even like you're clearly an experienced clinician, and there's no doubting that. So let's say you didn't have a lab, like you previously probably worked with some labs, right? And what did you like or dislike or saw like the obvious things they kept doing wrong, like even just in communicating with you?
A lot of labs have their pros and cons, right? Sometimes I think the best ones when they had a certain lab person communicate with you all the time, and they kind of knew your preferences, and you don't always need that, right? But I think the software, when they have the doctor preferences loaded up in there so that there's no confusion. Honestly, I've worked with some labs that we keep on telling them the same thing over and over, and they'll mess up the orders. So I guess you can tell us how your software can kind of help dentists and labs help with that. But that's kind of the biggest thing. The communication can be terrible, and the delivery times.
Delivery times, as in just they're missing which your due dates of tomorrow.
And some labs have got it really down, but their quality can be kind of inconsistent. Like a lot of labs, I don't know if you know, but in the USA, a digital lab, like when you send it off, the fourth day they're going to have it in your office, which is insane. That means it's only in the lab for 2 days, and they're shipping for 2 days. And that's kind of like the standard here, 4 to 5 days in your office.
In the UK, I'd say the standard is probably closer to 10, if I'm
10
honest.
days?
Yeah, I'd say it's not far
I would
off.
say it's
Like,
a standard, but a lot of offices deliver that service. I mean, a lot of labs deliver that service. 10 days is more reasonable. I don't even know how they do the 4 to 5 days. It's crazy.
all right. Yeah, it seems, yeah, it's fast. It's fast. And I mean, like it could be 4 days if everything was perfect, right? Everything was perfect, but there's no guarantee of that, right? How do this I can tell you with confidence in the UK, I've been in lots of clinics, and often what happens with the thing that's the biggest problem is they submit the scans and there's no like information about the shade. Like that right there is like the biggest pain point, right?
Yeah, that's super, super common. They'll send it, don't even put the material they want to use. I always say at least pick the shade so we can just pick zirconia for you, but you don't even pick a shade or a photo. And I think a big problem is if you're doing an anterior case, you have to submit a good photo where the eyes are aligned, the whites of the eyes are even, and the ears are even, right? If one ear is this, it's canted to that side. The ears and the eyes and everything should be even. Don't submit if you're digital, don't submit an anterior case without a photo to match it up, because you really want to overlay that and get a digital smile design with that case. But we see it time and time again that dentists don't even submit a shade photo or just a smile design photo in the anterior.
I got you. So we talked a lot about learning. So tell me, are you going to be going to any lab events this year?
I've gone to Chicago Lab Day for the past few years. I was speaking at there last year over dynamic articulation with Maja. This year, debating if I want to go or not. The irony is, man, it's in Chicago in February, the coldest months of the year, and you're freezing your ass off in Chicago. But it's a good time. Like thousands of people come there, so it's kind of like more like camaraderie, and you see things, you make good connections there. Other than that, IDS in Germany, I'll probably be there for sure. I think
I'll see you there.
Our partners are going to be there, so I need to plan and book that before I don't procrastinate on that.
Yeah,
those are the two big ones.
And will you go to the massive California one?
Compared to the
Look, I'm from Ireland, man. I'm from Ireland. We have a population of 4 million.
So we'll see. I always say if you can learn one pearl at these things, when you heard it a lot, but if I can just learn one thing, I've got a good weekend out of it. And it's really about the relationships now and seeing people.
I got you. Yeah, you travel a lot, like a lot.
Yeah, quite a bit.
Sometimes I message you, you're like, I'm in Japan, man. Like, what?
Yeah, I was in Japan for 2 weeks. I was snowboarding. Last week in Houston had an ice storm, so I was in Colorado for a few days. This week I'm here. And then next week I'll be in Las Vegas for our AACA, American Academy of Clear Aligners. I'm a board member there. I'll be talking about 3D printing to them. And then after that, I've got my digital course. And then after that, I'm in Dallas I'm teaching my digital course for our Maxi. And then it's continuous.
Jesus Christ. The digital course, tell us about that. Tell us
Yeah, so that's really the bread and butter. And people see that I do a lot of big cases. And I've kind of toned it down because I've kind of realized that I would overwhelm people, honestly, that I would go slowly. And honestly, I talk a lot. When I first started, I would talk way too fast. I listen. I think the problem is I listen to audiobooks at 2x. So then in my head, everything is fast. And I kind of, I guess people say I process information fast, so I talk fast. But I've got to realize that I'm throwing a lot of information. So everybody who's heard me says, man, you're so much better now because you slow it down. But if I tell you honestly, when I'm speaking, I think I'm talking like a turtle. Okay, this next step is this, and I'm slowing down there. Oh, that's a perfect speed. But I'm like, I've gotten used to that. This is correct. Really, I've really just made it simple. We start off with intraoral scanning now, get the basics and what I've kind of just told you, and we do a competition, and I kind of analyze what people are doing. It's kind of like getting that feedback, and then it gives people like an aha. Oh, I'm doing that. Oh, this is totally different. But I really show them that I scan an arch in about 18 to 20 seconds without fail. But it's kind of what I'm showing you, that it's fast and it's super accurate. And I've overlaid a lot of models in my scans to kind of show this with the desktop scanner, right? And then we'll go through that, show them that, and then we'll go through the photos, how to take photos, good records. And honestly, if you take those two things away, you'll be ahead of the pack on most people, because the idea is you want to get a 1% lab remake rate, not a 4% or 5%. 2% is good, but if you're, after taking our course, you're going to be at that 1% remake rate, because it's never always going to be perfect. But now you're giving good information in, and you're going to make the lab a lot happier. Labs have actually wanted me to lecture for them. I just don't have time in my schedule, because quite frankly, if we gave this information to labs, and you've asked me to do the scanning, and I'm gonna show that, the
We need
labs
to
would
put that
have a
up.
lot
Yeah.
more money because they would have less problems. So focus on scanning, focus on the photos, and then after that, I show the workflows on how we align and stitch the data together so they can kind of understand it. Because when you go to lab days, right, it's if you talk about aligning data and stitching data, you'll be like, okay, this is boring. Everybody's talked about this so many times, like as an advanced lab tech. But at the end of the day, there's so many people that don't understand how the alignment strategies work. So we'll do the alignment strategies and talk about 2-visit dentures, digital dentures, how to copy a denture and do those things, and really showing how dentists, I guess they see my Instagram, social media, Dr. Mike Tran, they see that I do a lot of full mouth cases. I'm showing them how we do all those cases all in one appointment without making like rescue bites and prepping all the teeth and saving it in a digital workflow. Get to understand fully digital.
I got you. You mentioned there's a competition at the start. What's that competition?
A scanning competition. I tell people, if anybody can beat me in a scan, you're gonna get $1,000 credit. And I
Has anyone got it?
Huh?
Has anyone got it?
Nobody's beat me yet, so
Nobody's beat you yet. Okay.
no.
That'd be a good one. That'd be a good
But
one.
now that they've seen how I want to hold it, and they can probably practice, because I barely see people that hold it with a finger grip like that. They're always holding it kind of further back and kind of looking at the screen, right? But if you can hold it closer up, you're just gonna be able to hold it really steady, and then I can just take the. It's a little nuance that makes a big difference.
I love it. Yeah, it's good. It's good. Yeah, it's funny. And you kind of like, it sounds like you're nearly like thinking about those lab remakes as like a point, like, it's like this is that you need to get 1% or you're doing something wrong, right?
No, it's honest. It's just facts, because I've seen it. I've overlaid my assistant scan when it didn't work, and then I took the impression and we overlaid it, and you can see the deviations. Of course, you're going to see more deviations on the lower jaw, because, like, I point out these little things, right? When you're scanning in the mouth, you want to keep them at the same height, because if you open up the masseters and the lateral pterygoids, these muscles are going to pull it down. It's going to deform the jaw a little bit. Little details, right? If you're doing this crown, people just get so used to starting on this side, and by the time you get here, it might be distorted. If you're doing the crown here, why don't you switch your scanning, start on the area you need to be more accurate first, and then do the rest of the arch, because that's going to be the center of your reference, is going to be more accurate. So in this limited amount of time, we can't do that, but I'm trying to give you the best points. But it's little things that, doctors don't really think about, and we weren't taught in dental school these things, right? But when you break down the technology and talk to the engineers how things were designed, this is how you should be really doing these things.
It's true, man. Like, it's crazy. I was speaking to someone who's in a dental school in Scotland and they don't have a scanner. Like, there's they're like, I don't know, has that changed in America or is that still the case?
Everybody's got a digital dentistry technology platform, but how far along you use that, how much you understand technology, there's always big differences, right? So I would recommend in the USA for sure, go to a dental school, so you're not like my friends that said we were all analog. Go to a dental school that gives you both, right? It's good to know the analog so you can understand the digital fully.
I got you. I mean, look, we've talked about lots of things. Is there anything else you want to touch on, man? Anything else?
Now let's give it a plug for your great lab, because I'm using that in my lab, and it's making it a lot easier. So we can have a patient portal, and we're using different, like, just email and using archaic techniques. I give a shout out to my buddy Lachlan in Australia. I visited his lab, which is an amazing lab down there in Melbourne. So honestly, I've talked to that guy for a long time. He's a front runner for technology for iMetric photogrammetry. He was really, really early, and I was like the first user for the new generation iMetric here. That was like 4 years ago, and it was a small company now. Fast forward later, it's really the gold standard in our industry around the world for full arch now using photogrammetry. But he kind of put me on to, that's how I met you with GreatLab. So can you tell us how your software is making it easier? What, to piggyback on the points that I was saying, like how to make communication easier?
Yeah, no, like we've obviously enabled loads of engagement pieces. We're trying to be a full CRM and lab management system. But it's interesting actually, because you talked about Lachlan. Lachlan had this great concept, which I think most labs struggle with, and dentists, is the ability to understand where the case is, right? Because often what happens is they kind of get lost, right? Just the work gets lost. So like we're now, and I can speak about this, is like enabling some features to make that really, really helpful for the lab, because it becomes this like, dentist is like, why didn't you follow up with me about the patient or something? Or, you know, and then the lab has also got this like job halfway through and not finished. Look, I won't talk a ton about that, because this is about you, man. I appreciate it so much.
Actually, that's probably one of the best things that it's kind of like everything else. You have some habits, right? We would have people text my lab manager, hey, when is this coming in? When is this coming in? And then finally I said, freaking put everything in GreatLab. And then they have a portal there. So it's also training. You do have to train the clients because they're so used to texting. It's so easy. But now the system that you guys have, that you can scan it and make the shipping label out, that's amazing. So you can track everything in the software.
Thank you. How's Tran doing in the lab?
He's a lot better. He's learned the software now, and now it's
good.
Really, I'm on him to transfer everybody to GreatLab. So every new client that we get, he makes them a portal, and then
that's great. That's great. Thanks so much. We love the feedback. We love it all. And tell me as well, but the last thing I'll just say is that so someone can meet you at IDS? Any other big events you're doing, like other than the Implant Institute? Anything else?
Our focus is on really turning general dentists to become an implant specialist when you go through our training, and you can take the credentialing on that. We do a maxi course, the Dallas maxi course. It's the only maxi course in Texas, so that's a big competitive advantage that we have, and we've probably got the best learning facility in the nation, unbiasedly. It's state of the art. It's brand new. Everybody who goes to that facility will say, man, this is an amazing facility, with partnership with Megagen in that facility. So they built it out for us. IDS in Chicago, Lab Day, and then I've got some of my digital courses. I've got it in Sprint Ray in June. I do that every year at their facility. And that's pretty much it that I can think of now.
That's great. Mike, you've been brilliant. Thank you so much for joining us.
Appreciate it, man.
All right, cheers, buddy. Bye. Thanks.